Hello, welcome back to my channel. Ngasi video sita koi lower eyelid surgery or lower blepharoplasty or Mitkha surgery matang da discuss tongminasi. So lower eyelid surgery have se kaino have da sida kari problem fix tong namno si surgery se. Koi gi mit makha da bags labor under eye bags or baggy eyelids adugi problem duna skin se excess stretch to halaga excess oiba natraga anurapegi excess skin duna wrinkles lakpa sigi problem yam se fix tongna lower eyelid surgery have se. So lower eyelid surgery se chathadri kanda kari evaluate to na phai and kari discuss to no haibada. Firstly, suitability for surgery. Yam nahaw eva mi kesu under eye bags later and kesu loose skin later mi malaga igi lower eyelid surgery to haidi mi do suitable or eduna taseng namagi under eye bags labor or excess skin and wrinkles labor haibudo check to ma changi and to later gadi to gadapani mayam lower eyelid surgery to phasato ina magisu tawraga hita phasani haba admai natte hadi akoigi upper blepharoplasty di mitup se picna yamuzu khachahon bayai suya yawdo mi hapayai adumaina anyone gi dum tawbi kitang extra skin le lothok bayai but lower eyelid surgery di anyone gi hekta tawba yaba surgery nate aduna suitable oidabra haibado yengba machangani and magi atopa laina leidana risk yang wangadra haibudo adu ma khangdokpa changani. And expectations, sometimes mi khagi expectations unrealistic oibi yawe haidi si taraga yam ka haina phajato kanin khamba natraga saje pura flat oiginin khamba natraga procedures pura scarless oigani kain khanba adugi expectations so unrealistic oibra natraga realistic expectations thambra haibudo doctor na wari sanaraga discuss taraga phajana explain tawba ma changi. Then risk haibada local anesthesia to short procedure ni aduna risk yam laibadi nate adaisu any short procedure oiragasu risk macha di laibayai hidak ta allergy to yai or saida adum bleeding swelling khar tawgani aduna saida ngangjala khochalakpa and adudai henna kesu adum upper eyelid surgery to bigi risk dumaina makha kisu almost adum manai haitare. Recovery say 1 or 2 weeks the swelling and bruising to would I am handarni but full recovery the few weeks changani but I am recovery the 1-2 weeks and a charpama high bi ado kayam swelling to would maybe 4 days kumba and by 1 week 2 weeks pram parani but fully healed daroga operation to from go yam kan u double operation to khang the few weeks changani. Next, anesthesia. Sigi operation ki damakta mise full on pra pangdhabra general anesthesia tawra natraga local anesthesia tawra. Local anesthesia tawi sai sida injection kapaga sai mapaze pangdhan doine local anesthesia plus local anesthesia natana koi sedate tongnaba oral tablet kharpi daga kitang tumning ba phawon ba magi pain sensation discomfort and akiba power anxiety do can reduce tong na. Next point is incision haidi akoina skin the len ba so akoina outside sida len bi sida len ba sigi kana ba sina akoina excess skin khar lok thokninga gadi soina khara skin khar lok thoga soina fochalam bi sigi skin je saina kitang tight oina ba. Another option is akoigi eyelid ki manungi sigi saruk se asidagi lelaga fat to approach tawga fat ki lokthokpa repositioning tawba adugi surgery to tawba adudana amuk excess skin or wrinkles ki problem di solve tawbi haroi aduna only for fat removal but som lagi tawba sina skin lokthokpa su yai and fat lokthokpa su yai but aduga sida scar macha ma laigani scar ki issue se yamna pakhaningai kesu oide yam fine oina yam clean oina pot lagadi akoi simple akoi gi laibak taga akoi gi skin line macha ga chain bodo khut kaje munna yenga di skin munna yenga di line macha chain mane adugi type ta dum sidai dum blend tawraga pakna khangba dark ka yam taraga hengwai hek yengba da mina operation tawi khangada bo mong natte adubu completely scarless ohinge risk no loroi gi haragadi hujiki mitki manungi sigi pink oiba area se asidagi approach tawraga tawbosu yai. So sigi incision se tawraga haidi sidai lianbo oigera manung romdagi oigera sina subciliary incision ko manung gi sina transconjunctival incision si tawluraga manung da kai adjustment tawrino haibida koina muscle and skin do si se koina adjust tawraga kara machet lakthoaga mapa chana adjust tawraga Korean pochan bakanda wrinkles or excess skin gi problem do solve tawbi ai fat tuna akoina phajana locate tawraga fat pockets tagi fat khar lakthoaga di excess fat sana mapan rom dan hangai di manung da phar lei ni adu aging process tuna tissue the loose or kana fat to mapan da protrude torpado adu gi fat to kara lakthopa natraga reposition tawraga akoigi contour haidi sigi magi shape se han tongtho lebado adudo phajahan ba yai ngasai fat lokthokpa muscle strip lokthokpa or hojiki skin kitang excess skin lokthokpa adudi hojiki kitang flat oiba look to pinaba so that youthful appearance to laknaba next skin incision do close tawagi dakar oi skin incision do akoina tawbakanda yam fine oina lang uhandabida manungda height torga photposu lei and lang do mapanda uzaraga su mapanda lang stage da macam hot ki tara urena lang urena hengwai dak uni habanati skin do akoina yam fine with the edge to edge pasana phot lagadi scarring jamle soi skin phot pakana swain khar chat khiba swain khar tawgiba khar lonjhanna ba khar chingjanara ga sainga tight oba adudane dak tari jai but yamna yam chap chana swaina ga thamagadi almost scarless oidoine aduna yam fine skin suturing tawba daka oi lang ugera urugera karambana lang na photli koli city yamna patient na concern oiningai oide whatever technique ta doctor duna photpodo adum scarless oigada already oigani recovery and result expectations kai thamba yai habase bruising and swelling 1 or 2 weeks ki khar laigani adudo tamna pharakani next akoi ki operation loiga cold compress haidi ice thombodo adu dakar laigani and proper healing gi damakta doctor ne hidak khar harakani swelling handanaba pain handanaba magi healing process to comfortable oinaba plus tissue healing do adu promote tawnaba sigi result se permanent oibra oidabra haibado result se permanent gumbane haitar permanent haiga chahi chama chatni haibdi natte long lasting oi and youthful and refreshed appearance ama pidoini permanent haibadi lokthokraba poto dum lokthokramina leiroi but koina chahi tara kun kunthra lega tamna amukka skin do chondhar oidra haiba ngamde adudi manungi ngasai gi khoi tissue do hena loose oragadi sum chondhara kani skin je sum jab loose skin gi type ta sum extra oragadi amukka wrinkle oiba loose skin appearance so dum lakpi but yam long term long lasting result ne haibatai procedure loirena operation loirena follow up gumba chataba check up chataba adudi recommend taude proper follow up doctor duna healing do and magi result lakpado monitor to wiyanaba and check up chatragadi aigi sigi zikpo mi je pharakadra healing je pharakadra dak pharaka concern yam leini aduna regular check up chatlaga pazana doctor gi advice loraga si se normal ni natraga si normal natri sidi kasu kairoi pharakani natraga sidi phararoi habado adu kupna somgi tawriba doctor duga phajana tanabna phai operation tawraga just lung satlaga adudagi disappear tawraga check up ka lakradi yamna wakhan nungai taba kai no doubt lerpa yaropo siai aduna proper check up and follow up taka oi thank you for watching this video sigi video sida pangiba information se kana hena khanbiragadi video the like button do namiramo and channel the subscribe to work out for future videos on medical conditions mostly cosmetic thank you for watching see you in the next one